Hating on Big Pharma has become pretty commonplace in many media reports today, especially ever since this guy was caught price gauging the cost of life-saving antiretroviral drugs for the treatment of HIV/AIDS. Now, that was several years ago, but the story of Martin Shkreli might still serve as a cautionary tale indeed. Let's also remember, though, that in the midst of the COVID-19 pandemic, pharmaceutical companies continue to save lives with cutting-edge vaccines. Many journalists now wonder what some of the best practices around reporting on pharmaceutical advances and related medical stories might be. Well, I'm glad you asked. This is GMF Compact. So here are some pills that I hope won't be too hard to swallow. Number 1, focus on the story. Just like with every other major news story, we have to weigh each headline concerning Big Pharma with great care. Just like we wouldn't club together all high school shootings or all terrorist attacks when we do have to tell these stories, it is also similarly dangerous to draw unwarranted parallels between various pharmaceutical stories. For example, Martin Shkreli, who I mentioned just earlier, has nothing to do with the opioid crisis in the US, which has cost tens of thousands of lives. So don't cluster these stories together in a bid to simplify a narrative. Number 2, keep business and science separate. Pharmaceutical companies are businesses. Now, you may or may not like that, but that doesn't change the facts. They do owe financial reports to their shareholders. And that's why you should make sure that reporting about the stock market performance of a particular big pharma player should be divorced from reporting on the results of its operations, on the advancements and cures the company works on, unless these are very clearly interlinked. Number 3, be constructive. The world is not the ugly place that we sometimes are tricked into believing it is. Yes, there may be unscrupulous people in any line of business, but there are also amazing news stories coming out of the labs of pharmaceutical conglomerates. For example, the widespread application of mRNA vaccines in response to the COVID-19 pandemic will likely also change the future of cancer treatment, delivering bespoke care in each case. Did you know that? And is that a story that you would want to share? Reporting should not be all doom and gloom. Bear in mind that there's a huge demand for constructive journalism, and this is one area where you can find a treasure trove of such stories. Finally, just remember that a spoonful of sugar makes the medicine go down.